a couple of seconds. God. Okay, you're live.
Okay. Hello and good evening, everybody. I'm sorry we're a bit late starting. I had a few technical issues and I've had to swap laptops over. Just to let everybody know that this meeting is being recorded, so people can look at it later on in the future if they miss the meeting. So hello everybody, and if you want to write questions, you're welcome to in the chat. It is a special ward forum meeting. It's not like our usual ones, and there is only one item of business on the agenda, and that is a discussion around COVID. Unfortunately, Dr. Justin Varney can't be with us this evening, but we have the lovely Mary, who is Head of Service for Test and Trace at Public Health England, and she will be here to answer your questions. So I'm going to pass over to Mary now, and she'll give it like an introduction, and then she'll be ready to answer any questions that anybody has.
Right. Well, good evening, everyone. And I should have asked, have we got BSL, or do I need to speak slowly for a translator, or am I okay to just go?
Okay to go.
Yeah, you're okay to go, Mary. We haven't got a translator on this meeting.
On this one, thank you. Okay, so where we're at is we've had COVID, and we've had COVID around for about a year now. I think perhaps if I start by providing some city context, and then I can go specifically into what our situation is more locally in Sparkhill. So the city context at the moment, we look at rates because that allows us to compare one area with another. Some wards are bigger than others, and it also allows us to compare with bigger sizes such as the city. So the city rate at the moment is 264 per 100,000. So that would be out of 100,000, we'd have 264 cases in the last 7 days. Now that is a huge number, but that is a massive reduction on what it was 7 days ago, 1 month ago, as you would know. So our rates are falling at the moment. I shouldn't say our rates are coming down. They're not falling. They're certainly not coming down as fast as we'd like them to. And we can go on to talk a bit more about why that might be. So that's the situation that we have across the city. If I look at Sparkhill specifically, just to provide a bit of context, in the last 7 days, Sparkhill has had 59 cases. So that is a rate of 271. So it is pretty close to the city average, which is a good place to be. The population of the ward is about just over 21,000, just under 22,000 people in Sparkhill. So 59 cases is about city average. So I'll just go on and talk a little bit more about some of the other issues that we see in Sparkhill and across the city. So, and I'll do this sort of very briefly, and then I'll take questions rather than giving you a whole, 1 hour session of me just talking. So what we're seeing across the city is that the vast majority of people who are the majority age group for picking up cases is 30 to 40, or in fact you could broaden that to say 30 to 50, 30 to 60. So it's typically working age people. And when we look at routes of transmission, because we will ask questions about where people have been, who they've been in contact with, the two main modes of transmission in our city, right up there at the top, is household transmission. So that means one person gets it in the household and then it's transferred to others. The second that is coming up, obviously, is contact with family or other people, which you might appreciate in a national lockdown, we shouldn't be seeing a lot of. And then alongside that would be transmission in the workplace. But by a margin, household transmission is the way that many people report that they have become cases. That is particularly important for us because household transmission is not inevitable. It is not inevitable that if one person in the household gets COVID, that everyone else has to get it. but there are steps that we need to take to reduce transmission. And we totally appreciate that that may be more challenging in some homes than others. But again, this is part of what we need to understand and take on board to halt transmission. So as I mentioned that in the last 7 days, we've had just under 60 cases in Sparkhill, and that's about city average. So the messages are back to basics about distancing, and about hand washing and about using face coverings. But in the home, if that's a major source of transmission, we often signpost people to something called Germ Defence. Now, Germ Defence has broken down step by step the measures that can be used to reduce transmission in a home. So it gives you simple things like if one person is a case and you've got to use a shared bathroom or shared kitchen, as we do in most homes, that person, as much as possible, either does not go into those areas if things can be taken to them or left for them, or that they go in, that the most vulnerable in the household, for example, will use the bathroom or kitchen first, and then others, and then and each person, you know, cleaning after them, and then eventually to the case. So there are measures, and we will signpost you to there. The other thing that's probably worth talking about is the community engagement work that happens in the area. So some of this is citywide and some of this is specific to areas of the city. So if I mention, for example, just see if I can share a slide or two, just a quick summary of some of the things that we are doing at the moment in the area. Is that sharing?
Yeah, it's sharing.
Yeah, it is. Right. So we've got a number of networks on our mailing list, and they get regular updates from us. And some of these networks are across various areas of the city, but we've just identified some here that we know happen to work in Sparkhill Ward. And we work with our faith communities, Muslim and Christian. Obviously, we are in regular contact with our councillors and they get updates. We provide those weekly. And we also are in contact and network with our general practitioners, so the NHS partners and colleagues in the area. On the community provider side, so I don't know if that's changed. It should have changed. We are working with Citizens UK, Bahu Trust and Sri Hindu as examples, but we are willing to work with wider networks, and one of those will come on to in a moment when we talk about our COVID champions. So we know that Sparkhill has a younger age profile than the city as a whole, and so we are looking at what we can do with and for and by young people to encourage participation and compliance. And part of that is our Generation Z campaign. In my team, we've also got COVID champions. We've got them up and running. We are recruiting. We're aiming for 1,000 in the first instance and then 1,500 across the city. Part of the work I've been doing is to say, well, actually, have we got representation both in terms of numbers, but also in terms of all the other characteristics that is the richness of Birmingham? And indeed, for yourselves, it will represent the richness of Sparkhill. So at the moment, we have 9 COVID champions. We would need 23 at this first stage, and I'd seriously encourage anyone who isn't a COVID champion to consider becoming one. What you get as a COVID champion is you get information from us, regular information from a trusted source that you can share with friends and families and all your networks to say, this is reliable information, this has come from Birmingham City Council. And I don't say that just because I work for Birmingham City Council, but we will tell you the source of our information. So when we produce a pack, we have on every, people go through every single slide, and we have a source for all of the information, for all of the data that we put there. And as things change, so for example, whether we're changing tiers or we're in national lockdown, or what the guidance changes are, We say what that means for us in the city. We say what that means for our various communities within the city. And that's something that we would then look for our champions to also feed back. So it is a two-way communication and engagement. We've got webinars as well that we encourage COVID champions to participate in and to feed back to us what is the lived experience of COVID in their community, amongst their friends, amongst their families. Are there things that they need to know that they're finding difficult to discover, to reach? Are there ways we can improve access? Are there messages that we want to feed back? Are there themes emerging? If people need to isolate, do they know how and where to get that help? Do they know for how long they need to isolate? If people are being pressured to work when they shouldn't be working because they should be isolating, or pressured to return sooner, do they know that there's a whistleblowing helpline, for example? So it's really about connecting, making sure that we are reaching into the community and the community is able to reach back to us and tell us what we need to hear. We're not leading on vaccine work in the city. That is being led by the NHS, but we are supporting that. And so part of that is, at the moment, there's a series of 5 events. There's one going on today. There was one 2 days ago. There are 2 more next week. And even though they are listed as being in certain parts of the city, so they are distributed geographically, there's absolutely nothing to stop you from dialing in, joining in on those events, and listening in and asking questions. And they are very, as I say, I've attended one. They are very, very well compared, and they do take questions from the judge. You just put the question in the chat and someone will address it. It gets addressed specifically. So there's engagement work going on. In addition to the national messages, we can provide updates, and we do provide updates through our COVID champions, but we also do through other avenues. And I think I'll probably stop there and see what questions we have or any clarification that's required today.
It is swapped over. So thank you, Mary. Our first question we have is from Jamil, and it just said, what is a COVID champion? So I just think he wants a bit more clarification on what the role is.
Oh, that's brilliant. So the COVID champion is a member of the public. It's absolutely anyone. So councillors, public health people, your neighbours, your nan, your brothers, sisters, anyone can be a Birmingham COVID champion. There is a web link which I'm just pulling up, and we encourage you to join. It's really simple to join, and we would encourage you to consider it. What we ask as a COVID champion is that we say, well, what would happen when you sign up? So you sign up, you take some very basic information from you, you start to receive information from us, you get invited to exclusive webinars. They are optional, but we would highly recommend that you take the opportunity, because what you get to do is you get to speak to topic experts. You will also have the ability to ask the public health team questions, but crucially, you get to let us know what is and isn't working in your community. And that way we can make sure that everyone has information that they need to stay safe and healthy, but also information that they can trust. Does that sort of answer your question, or do you want a bit more?
Oh, I think that's good.
Yeah, I mean, it's really simple criteria. As long as you live or work in Birmingham, you're over 18 years old, you're able to receive emails, and you can access some Zoom meetings, have access to a mobile phone. And the real attribute of a COVID champion, and the ones that make really, really great champions, are people who are passionate about making sure that your community, your network, receive reliable and up-to-date information about COVID. Obviously, we want you to work in a non-judgmental way, be reliable, be a good listener, but be able to give and receive feedback, because we would see you as a COVID champion as a conduit to the community. We've got different ways of reaching our community. I say our community because I'm a Birmingham resident as well. We've got different ways of reaching our community, and we need to continue to have that open dialogue in both directions.
So hopefully we'll have lots of people that are on this call now signing up. It is a great go-between between the community and the council and public health. So it'd be great if we could see some of the residents and people on this call and encourage people you know to take up that role. Our next question is from Anonymous, and it says, do we know the rate of vaccine take-up in Sparkhill/Birmingham and how that compares with the national rate? So a vaccine question.
I knew there'd be a vaccine question. So the first thing I've got to say is I can't tell you what the vaccine uptake rate is for Sparkhill specifically, or indeed for Birmingham. The rollout of vaccine uptake in the country is being led by the NHS. The NHS has been tasked to do it because, as you know, between our hospitals and our primary care GP system, we've got a fantastic network that can reach right across. So they are giving the vaccine out. My understanding is that we have done well. There were 9 priority groups identified by the government, and the first 4 who started was those people who we consider to be most vulnerable. So just to recap, is that we're giving the vaccination to prevent death, to prevent serious illness and hospitalisation, and we're looking to protect the most vulnerable. And so for that reason, we have vaccinated people. We started with people over 80, and then it's gone down to people over 75, and then people over 70, and it will work its way through. There is sufficient vaccine. There have been no vaccine shortages reported, and indeed in some parts of the city, they've got through those first 4 categories, and they're ready to go with the next category, the 5th one to be identified. So if you do get an ask to come for a vaccine, I would strongly recommend that you take it up. But there's good uptake is what I've been told for the West Midlands, and specifically Birmingham. Haven't heard any issues otherwise.
So we have another vaccine question, and it's from Abdul, and it says, taking into account the disproportionate level of BAME positive cases and mortality rate, has this been taken into account when considering the rollout of the vaccine, especially taking into account the makeup of Sparkhill residents?
Yes, so I think it's fair to say that that has been taken into account. There have been different groups that have been particularly vulnerable and susceptible to COVID, as we've seen in the last year. And taking all of that into account, I think that the strategy at the moment is to get as many people vaccinated as fast as we can. You will be aware that there's been a slight alteration to the staggering of doses, and that was so that we could get more people their first vaccine. So if you get 100 people and you can offer that vaccine to 80 of them, and you give them 2 doses, and it gives them, the most protection that is possible. But on another hand, you're able to offer that vaccine first dose to all 100 people, and then start some on their second dose, and that gives them 80% protection. I think that's what you'd want. So I think the approach of trying to cover as many people with the first dose and then the second dose has taken into account the needs to cover more people as fast as possible, including our BAME groups. Because even within our BAME groups, we will have people over 80, and then over 75, and then over 70, and we work through that.
What I'll do now is I'll take 2 vaccine questions together, and then I'll move on to other questions. So the first one is, can people choose which vaccine they receive? And have there been any serious side effects from taking the vaccine in Sparkhill or the city? So that's the 2 questions.
Good question. Can we choose which vaccine? I don't believe we can. but I am happy to go and find out more information. I wouldn't imagine so, and the reason I say that is that the requirements for each vaccine are very specific. So with one of the vaccines, it has to be kept at an extremely cold temperature, you know, to be able to use, and therefore it can only be used in certain settings where that can be maintained. The other vaccine is much more logistically friendly, and so that would be the vaccine that you would get in many more places, such as your GP surgeries. So I don't believe that if you went to a place to get a vaccine, you would have a choice. But if there were a strong view about one vaccine or the other, and that's a possibility, I could certainly find that out and share that information. The second question about that, sorry, I forgot what the second question was now.
The second question was, has there been any serious side effects from taking vaccine in the ward or city?
So serious side effects, no, none that have been reported that I'm aware of. And the reason I can say that with confidence is there is something called a yellow card scheme. It's all electronic now, but it used to be a physical yellow card. And with that yellow card, anybody who had an adverse reaction to any drug, not just a vaccine, would be, they would be required, they'd notify their GP or who had given them the vaccine, and they would be required to report that. That is a requirement. As long as we're notified that somebody's had an adverse reaction to any medication, we are actually required to complete a yellow card. That applies to all drugs, that applies to these vaccines. If there had been a situation, I'm sure we'd have been informed of it, but from my regular contact with NHS colleagues, no, there hasn't been.
Now there's another vaccine question which I think is actually quite important. If somebody had refused to take the vaccine before, maybe they were listening to scare stories or something, if they were then convinced that it was a good thing to take the vaccine, would they be able to have it?
So if someone's changed their mind, absolutely, and we have had instances of that. So what the current rollout is that we offer the vaccine to people. Obviously, there's information out there. Some people take a little while to make up their mind, and I do personally know of people who have refused the vaccine. And then after I've spoken to them, they said, well, okay, I'll go and take it, and they have. And that offer is made repeatedly. So it's not a single offer. Obviously, for your protection and protection of your loved ones, we would encourage you to take that up as soon as you can, because the sooner we are able to protect everyone to some extent, the better. But if you have previously said no, and then you change your mind, just put your hand up, get back in touch with them and say you've changed your mind, you're now ready to take the vaccine, and they will give it to you.
So moving on to a different topic now. At one point, Sparkhill was highlighted as having a high rate of positive cases. Where are we now compared to other wards in Birmingham? Has it decreased over this recent lockdown?
Okay, so I knew that might come up. Let me just see if, gosh, I should have done a quick count beforehand. So, yeah, so there are some wards that are frequently in the sort of top 10, top 15. They might change position slightly, but I'm just doing a quick count as we speak to just see what position we're in. It's 10, and that's, so where's Sparkhill? Good grief, you're not in the top 10, not in the top 15, you're not in the top 20, you're not in the top 25. This is looking good. No, we've got to top 30, and you're down at about number 33. So that would fit with my earlier comment about around being city average, or pretty close to city average, and we've got 69 wards. So if you're about number 33, number 34, you're around about the middle of the pack. So I'd say well done to Sparkhill. You know, you're clearly doing something right. Keep up with all the prevention measures. And I should also say that even if you do get the vaccine, or when you do get the vaccine, you will still need to maintain those prevention measures. Having had the vaccine does not mean that you can't pass it on to others. It doesn't mean that we suddenly stop the distancing and the hand washing, etc. But at the moment, Sparkhill is in a much better place than it has been on occasion.
But that's really good news to hear. Another question that I had actually was, do we have any information on the South African variant that was found in Northfield? Although it wasn't found in Hall Green or Sparkhill, is there anything residents should be aware of with that?
Yes, so a few things to say about South African variant. So you will probably all have heard of Operation Eagle and South African variant. So what we're doing at the moment in some parts of the south of the city is we're doing what we call surge testing. So we've identified a very tight area. It's a bit bigger than the ward, it's about a ward and a quarter. And we are testing people in that area to see if there is an increased rate of community transmission of South African variant. So not everyone in the city will have South African variant. We're looking to see who does. We happen to have had a case there, and we're just looking to see how much more was around there. So previously, people would get tested and they get a test result, positive or negative, and that still goes on. Of those positives, some of them would be selected for what we call genomic sequencing. And the sequencing would then say what type of coronavirus we've got. Is it the same type we've had this time last year, or is it a slightly different one, you know, like a cousin or a relative of it? And what we found was that, yes, there was some South Africa variant. What we're trying to do is see how much more South variant there is. Now, sequencing would typically take about a few weeks to happen, but because we're actually concentrating on looking for it, all the people who test, who live and work in that area that's identified in the south of the city, will all be tested for South Africa variant. And that will give us a sense of, we know there's been some there, how much has it spread? So how much has it transmitted to people? As far as we know at the moment, the illness that is associated with it is no more serious. The hospitalization is no worse. And there aren't, as far as we know, there isn't, as far as we know, greater mortality associated with it. At the moment, what we do know is that it's much more transmissible, which is a nice word, fancy way of saying it's more infectious. So when we say stay 2 meters apart, it really does need to be 2 meters apart. And so far, it's early days. I think today is day 8 of that exercise down in Frankly Great Park and bits of Northfield. So far, we haven't been given any results to indicate that they have found any, but it is very early days because sequencing takes, previously it would take about 3-4 weeks. We're hoping to get it down to about a week, and we haven't had any feedback yet to say that they found any. But as I say, it is early days. So in Sparkhill, with regard to South African variant, I would say you should be as concerned as you would be for the regular COVID. Maintain the distancing, maintain the hand washing, continue to use your face coverings. And those are the prevention measures that you need for all the coronavirus that we know of, whether it's the regular ones or whether it's one of these new variants.
And we haven't had any more questions in the chat. So is there any more advice, Mary, that you would give to people? I know that it's good that the infection rate has gone down and case rate has gone down in Sparkhill, but obviously we can't be complacent.
Yes, so I think my advice really would be about, we've got something we call Germ Defence that we really try and encourage people to consider. I'll just see if I can share it. It's always tricky when you've got so many things on your so many things on your, oh dear. Right, okay, let's go. because I think it's helpful for people to see this. This is practical information it's something we can all do and we all do at home. So you should see on the screen now something called Germ Defence. So this has been checked out by our colleagues nationally, and it's been approved. And what they've said is it takes 10 minutes only, and you just go through and you click a start, and it'll take you through and tells you a bit about coronavirus, how it works, how it's transmitted, and so on. And step by step, it shows you the things that you can do to reduce transmission in your home. I can't stress this enough. When we look at the methods of transmission from our contact tracing data, over 80–90% of it is transmission in the home. So, you know, even if we haven't got a person who is a case, these are the practical things we can do. You don't get illness from just one virus, but you will get ill if more enters than your body can cope with. So we're not going to have a perfectly sterile environment in which we live. You know, so nobody's saying wash your hands all the time and stay at the sink. We do have to function. However, we can reduce the amount that's spread between us. So fewer germs, less illness. It's pretty straightforward. This is also a very young person and child friendly way of doing it. So it's, you know, the science is there, but it's really, really accessible. And it says what you do. You have your vaccination. Yeah. What else do you do? What do you do after it? You know, it takes about 3 weeks for you to get the benefits. So they do suggest that for the few weeks after your vaccination, you maintain, you know, be really rigorous with your precautions. Hand washing is really, really critical. You think, well, hand washing, surely everyone knows that. Reducing illness to people you live with is key. Every time we have one person in the household, you need to think, well, do they use set cutlery? Do they use set plates? What do you need to change in your home to prevent people getting the virus? So that's what you do to prevent your household getting the virus at all. So, you know, ventilation, opening windows, wiping surfaces, what we call the touch points, door handles, cupboard handles. There are certain places that viruses love to be because that way they spread from one to another. So I'd strongly recommend that you look at Germ Defence and pick up some things there. The other thing that I would obviously say is do sign up to become a COVID champion. We are going to be living with COVID one way or another for a little while. And so the more information we have and the more trusted information we have, the better prepared we are for what we have to do. There is a lot of information out there, and sometimes it can be a bit difficult to know what information to trust. So we're not just sharing information about, well, this is the rate in Birmingham, you know, wash your hands, but it's the practical tips. We're getting people to say what they've done in their areas to reduce transmission. So there's COVID champions are absolutely really, really important for what we're trying to do, and they have made it possible for us to get this far. I'd like to see Sparkhill with its full complement of COVID champions.
I will make sure I post the link again on how to be a COVID champion onto my social media and onto WhatsApp groups, community WhatsApp groups I'm in. We've had 2 more questions, which I'll take at the same time. One is a very lovely, optimistic question, and it said, when can we start thinking of booking holidays? So that's the first one. And then the second one is, if you think you should have been offered the vaccine by now but haven't had any contact, should we contact our GP, or is there another contact number to call?
Right, so I'll take the second one first. So if you feel you should have been contacted for your vaccination and haven't, actually, I would suggest there is a really good website. Gosh, I'm going to see if I can find it now. the Birmingham and Solihull CCG have got an excellent website, and they have information on there about how they are proceeding with the vaccination rollout, and that's where you go. That would be your first port of call. Just calling it up. Here we go. Have you got have you got a chat that I can pop it in? Show, no, it says show Q&A, but I can't see that. It says show conversation. I'll put in the conversation one, and perhaps
and then I'll post it across. Yeah, be
able to lift it. Yeah. So that's the Birmingham and Solihull vaccine website. Really good. And if there's anything in there that you think that information isn't there that you want, or you can go straight to them. But we have had people come with messages to us. We work very closely supporting the NHS, and we do provide feedback on things that people have looked for on their website and not quite found the answers to. The government sets the direction of, the JCVI advise actually on who should be vaccinated. It will have information about what progress we have made within Birmingham. So if you are, for example, in priority group 4, and it says we are now vaccinating priority group 5, and you think, oops, I've been missed out, then absolutely raise your hand. But other than that, I would say no. Generally speaking, our general practitioner colleagues are under immense pressure, and so their preference would be that you wait. But if you feel that you have been missed based on the priority groups that are set out, not on your thinking of what priority is, not based on the sort of work you do, but based on the priority groups that they have set out, then absolutely, if you feel you've been missed, raise your hand and speak to your GP. The other question is about holidays. And my suggestion would be that we need to think differently about holidays this year. I can't see through to summer and the sunshine and everything being back to how it might have been, say, in 2018. So I would say if I were planning holidays at the moment, I would be thinking of something preferably local, and that means local to where you are. I wouldn't be making plans to travel hugely just at the moment, not even within the United Kingdom. It's far too soon to say that it's safe to do that. So if you must plan a holiday now, because we do need a holiday from time to time, then think about what you can do much more locally. At the moment, it's national lockdown, so you can holiday. If you've got a garden, you can holiday in the garden. You can go to the local park for an hour and have a pretend holiday. But better times will come. But this is going to be with us for a while. So I would say, think local when it comes to holidays. You will have seen in the news what the requirements might be for people who go farther away from home. And as COVID throws us a few curveballs, you might go somewhere far away and you think it's safe to come back. I'll just go for a week or two. And in that week, something happens there or here that means the requirements when you come back have changed. So my advice would be keep it local. And anyway, we want to keep the money in our local economy. So, have a local holiday would be my suggestion.
Okay. The advice there is have a staycation in Sparkhill. Some of the shops on the Stratford Road do that lovely slush puppy thing, which always reminds me of being on holiday. So maybe you could go get one of those and sit in Sparkhill Park, but make sure you put your rubbish in the bin before you go. Two more questions which I'll take together. One of them is about local businesses and how is the City Council helping local businesses to say more COVID safe? And the next question is, do we know the number of deaths due to COVID in Sparkhill since the start of the pandemic?
Right, so again, I'll take the second one first. So the actual number of deaths in Sparkhill since the start of the pandemic, I don't have that data to hand. I do know that there is on the .gov website, there is that information for Birmingham as a whole. I don't think that that information would be publicly available for awards such as Sparkhill, simply because we have what we call small number concerns. So there are things that we, when it comes to publishing data and it's small numbers, because there is the potential to then identify individuals, we tend not to. So I would say, if you want to get a sense of what impact that has been, look at the city rate. That information is publicly available on the .gov website. But for something as sort of the size of award, I would be thinking these are friends, these are neighbours, and I probably wouldn't want to be thinking about them as numbers. I'd probably not want to be sharing that. Local businesses, helping them to stay safe. Yes, we are. Yes, we are, and we would like to continue to work with them to keep them safe. So I know that I work closely with my environmental health colleagues, and we've put out messages for the prevention measures that people can have to stay COVID safe in their workplaces. That's both from the employer's perspective and the employee. Sometimes it's a poster that they need to put up if it's a shop, asking people, to wear a mask, to queue in an appropriate distancing, how many people they can have in the shop. So there is support for local businesses. We are also working, I don't know if any of the bids are in your area though, but we are looking to have COVID champions for businesses, for employers. And the idea is that these would be COVID champions, just as we have for residents and the general public, but who are thinking much more about, well, what does this mean for an employer and an employee? And the reason we're thinking about that is because we know that when we get through this, we will need to reopen the city for business in its fullest form. And we'll do that when it's safe to do so, but we will need to know, and we need to make sure that our employers and our employees know what is required to be COVID secure at work, but also the behaviours and the things we have to do away from work that impact. So I'll give you an example. We have an outbreak at work. We're saying, well, what happened? Did you maintain distancing? Yes. Did you wear PPE? Yes. Did you wash your hands? Yes. And you did that while you were working? Yes. Well, what happened during break time? Well, we staggered our break. Oh, really good. And then what else did you do? Well, actually, a few of us huddled outside for a cigarette. Well, clearly you weren't wearing a mask, you were close together. So one of the issues we're finding with businesses is actually just people maintaining that vigilance all the while. It's very easy to let your guard down for a moment. But also there's the issues of things like car shares, people that meet up outside of work. And so some of the situations that arise at work are actually because of the employees' lives and lifestyles and choices outside of work. So I think we're recognising that whilst businesses and employers need support, and we will give that we're also looking to work with the employees and our workforce, so that whether it's because you're working there as an employee or we, the customers who go into those businesses, that we help to keep them all COVID secure. If there is, if help is needed or advice is sought, there is something on the BCC website, and certainly I know that our regulatory services and environmental health colleagues offer advice and support with regards to keeping people COVID secure. Does that answer that question?
I can't see any new questions, so if you'd like to sum up, Mary, about anything.
Sorry, Councillor Brennan, there's a couple.
I'll see if I can scroll down.
Can you scroll down?
Okay. Where do you find out about COVID-19 champions for businesses?
Okay, so we're going to be rolling that out. I would say check the BCC website because it's going to be there shortly.
I think some more have come under. And one said, what is the rate of excess deaths in Sparkhill over the past year?
It would come into small numbers, so it probably wouldn't be accurate for us to do excess deaths. In Sparkhill is about 20,000. It probably wouldn't be terribly accurate to do that for a population of that size. So I'd say that the city rates might be better.
I might be wrong, but now I definitely can't see any new questions now. So I'll pass over to Mary to wrap up.
Okay, so in summary, we've had about 12 months of living with COVID. It's been a roller coaster. We have learned huge amounts. You know, I'm an epidemiologist. If a year ago you'd have said a what? Now you know what an epidemiologist is. You know about the R number. So we recognise that the public, our young people, our businesses have learnt, as we all have, we've learnt a lot about coronavirus, learnt about what we need to do to stay safe, to keep ourselves and our loved ones safe. But we need to continue. We need to stay the course. At the moment, our rates are coming down. They're not tumbling, but they are coming down, and we need to stay the course. I liken the national lockdown to a prescription. If you go to the doctor and they give you a prescription, you take a piece of paper home if you get the old-fashioned prescription, and then you go to the pharmacy and you say, this is my prescription. They give you the medication. You take the medication home, but you've got to take the medicine. So just being prescribed with a national lockdown isn't enough. We actually need to follow through and only go out when we're supposed to go out, only go out if it's essential. That's the equivalent of taking the medication. So when we take that medication, we will get the best result for Sparkhill and the best result for Birmingham in terms of our rates. And that will put us in a really good place when we're coming out of this. So I'd ask everyone to remain vigilant. It's nothing new. It's still the same thing about maintaining a distance, wearing face coverings when you're out, hand washing, and really being vigilant about hand washing and cleaning touch points in the home. And then encourage one another. We've got months of this ahead. So do stay in contact with one another. If you can and you are willing to be a COVID champion, we'd be delighted to meet you. But encourage one another, because we will get through this, and we will get through this best together. So that would be my message.
Thank you, Mary, and thank you for taking the time to come and meet with us this evening. It's been really helpful and informative. And thank you to all the residents that have come along and asked questions. And also thank you to Kay in the background, who has facilitated this meeting and made sure it's all run smoothly, even with my laptop problems at the start. Just to let residents know, we're in the process of planning the next Ward Forum meeting, which will be in March, and I will post the information about how to become a COVID champion on my social media after the meeting. And I hope you all stay safe and hope to see you all soon. So thank you for attending and have a good evening.
Good night.